not like you come in and I'm like, today we will learn ballet technique, right? We're not going to do that. It's more
Yeah.
finding movement. We can put on music. It's less structured. There is
Mhm.
structure, but there's a lot of movement observation and mirroring based on what the client needs. And you're not coming in and being judged. And I think that's one of the fears around dance, especially.
Beautiful. So you kind of talked about it just a little bit right now, but do you want to walk us through like what a intake or a dance therapy session might look like so that clients know a little bit about what to expect if they work with you?
Sure. So the first thing is, I kind of asked people why they're here, what drew them to dance therapy. And we talk a little bit about, their goals. So we kind of have that framework first.
Hmm.
And then, that's always in the back of my head as we're doing movement. It's because it's not super structured. Or I can place a structure in, like someone's like, I'm struggling with, depression. And then it might be like up to me to be like, all right, what props could I bring in that would help, elicit a different movement quality? So depression, there's a lot of heaviness. A lot of times there's a lot, from what I've seen, there's a lot of concavity in the chest, and
Hmm.
your movement sphere, like your kinesphere, is like really small. Like you're not going to be making big, huge movements if you're depressed, right? So then I'd be like, what can I use? And I'm not going to also shock my client from going from, concave, small movements
Hmm.
to huge movements that are going to really be expressive. That's not going to work. The
Yeah.
client's going to feel so uncomfortable. So,
Yes.
what movements or props could I bring in to help that client do a different movement repertoire, start to move different, which will allow them to
Mhm.
feel a little bit different?